Hello, everyone. Welcome back to the Therapeutic Guidelines by Qurat Atif. This is episode number 2 of our Therapeutic Guidelines series, where I help you learn and revise on the go. If you are new here, I have created this series so you can listen while driving, cooking, commuting, or anytime you want to study without reading. So today we will be covering our second chapter, which is dental prescriptions and prescription writing. So let's get started. Overview of legislation about prescription and prescribing. So the information included in this topic is appropriate for dental practice and may not be applicable to other areas of medicine. For legislation, sorry. So for legislation pertaining to obtaining, processing, prescribing, supplying, or administering drugs in each of the state and territories. We will see at page number 10. But again, this is not important for the exam point of view. Dentists should follow the appropriate legislation for their state or territory. Overall, the requirements for what constitute a legal prescription does not vary significantly between the states and territories. Dentists may prescribe prescription only drugs and drugs available over the counter, provided the drug is for the dental treatment of a patient under their care and the prescription complies with the relevant state or territory legal requirements. I'm reading it again. Dentists may prescribe prescription only drugs and drugs available over the counter, provided the drug is for the dental treatment of a patient under their care and the prescription complies with the relevant state or territory legal requirements. Prescriptions must be written for use by only the person named on the prescription. The prescription must not be written under a person's name to obtain stock for use in the practice on multiple patients. Additional caution should be exercised when prescribing drugs of dependence. So, what are the drug of dependence? There are some scheduled 8 drugs which contains codeine, oxycodone or morphine. There are oxycodone and some patches also, and there are some schedule 4 drugs which contains benzodiazepines. Okay, so we should take an additional caution when we are prescribing those drugs. Additional caution should be exercised when prescribing drug of dependence. Dentists should be aware of the relevant legislation for their state or territory pertaining to prescribing drugs of dependence. Drugs of dependence include some Schedule 4 drugs, for example, benzodiazepine, and all Schedule 8 drugs as outlined in the relevant state and territory legislation. Now, there is a star at the bottom of this page, and I'm going to read it. The role of prescribing and supplying of drugs to patients are usually separated to avoid a conflict of interest and promote medication safety. If a dentist decides to supply drugs to patient, they must ensure that dispensing is performed to the standard of a pharmacist with appropriate labeling and documentation. Sometimes those stars at the bottom of the page, they are very important for exam point of view. In most states and territories, dentists can prescribe a drug of dependence for a patient under their care, provided all the following points are fulfilled. So, what are the dot points? They are very important. First, they do so in accordance with legal requirements. They also have taken all reasonable steps to ascertain the identity of that person. They have ensured that a therapeutic need exists. and the drug is required for dental treatment only. So these are the dot points, they are very important. Misuse of drug of dependence, particularly opioids, is increasingly prevalent. Drug dependent and drug seeking patients can present to a dental practice. Be circumspect if a patient demands drugs of dependence and exhibit a good level of knowledge or a preference for a specific drug. So you have to be mindful if the patient has a good level of knowledge, or he's asking for any specific drug, then you should be careful. When prescribing drug of dependence, dentists should be familiar with the prescription shopping program, any state-based real-time prescription monitoring services, the state or territory legislative requirements to notify authorities of for fraudulently obtained prescription of drugs of dependence. So they're not important for exam, but we should know about it. Legislation about prescribing for staff, family members, or for the purpose of self administration varies between the states and territories. However, generally, self prescribing and prescribing for staff or family members are not recommended. All right. Now, again, there are few things on this page. Legislation, acts, and regulation relevant to prescription and prescribing. They are not important for exam point of view. There are some different states they have mentioned, but again, they will not ask you an exam, so we can leave them and we can jump onto the prescription, how to write a prescription and what things we can include in the prescription. So a prescription is a legal document. It is a written communication tool between a prescriber and a pharmacist for preparing and dispensing a drug for a patient. Who may write prescription and how they should be written are outlined in the appropriate state and territory legislation. To reduce the potential for error, the prescriber must provide a prescription that is legible, clear, and unambiguous. Although computer-generated prescription can be easier to read than handwritten prescription, errors can still occur. Essential information required for a legal prescription written by a dentist varies slightly between the states and territories, but generally comprises. So, what are the different things which include in the prescription? It's the prescriber's name, their address, their phone number, and their qualification. Patient's full name, given and family name, both, address of the patient, age, and date of birth. Specifically for children, include the patient's weight also. Date the prescription is written, drug name in full, preferably generic or approved name. Then strength of the drug, for example, how much, 250 milligram or 500 milligram. Drug form, for example, in a form of tablet, in a form of capsule, or it is a mixture. Quantity of drug to be supplied, drug dose, route of administration, frequency, and duration of treatment. Then clear instruction for the patient in English. It is not appropriate to write take as directed. Any further instructions necessary for the pharmacist. And the word for dental treatment only. Handwritten signature of the prescriber. So we'll see on page number 14, there is an example of the format required for a legal prescription written by a dentist. And I have also heard there are some updates in September 2025 in regards to therapeutic guidelines. And there is some new diagrams for prescription format. I don't have available with me right now, but there is some new diagram over there. So you can have a look when new TG will come. Okay. So figure number 1 is an example of the format required for a legal prescription written by a dentist. If the prescription is for an item included in the pharmaceutical benefit scheme, which is a PBS, the dentist's unique prescriber number must be on the prescription. So PBS prescription pads are available from Medicare Australia. If the prescription is for a non PBS item, a PBS prescription form may be used, but all references to the PBS must be crossed out and the form endorsed with the words private prescription should be written. Now, points to be noted when writing a prescription include: aim to make the prescription tamper proof, unalterable, which means you can use indelible ink. Then use plain English. Do not use abbreviations or Latin terms except for standard recommended abbreviation. For example, mg for milligram, ml for milliliters. Okay. Now, do not abbreviate microgram, nanogram, international, or unit. Avoid using decimal points if possible. For example, write quantities less than 1 gram as milligram and quantities less than 1 milligram as microgram. For example, you can't write 0.1 gram, you can write 100 milligram. Okay. If using a decimal point, put a 0 in front of the point. For example, 0.5, not only 0.5. Otherwise, patient can write anything like 2 or 1 or 6. So always use 0.5. Okay. Limit the number of items on a prescription to 3. Or if you are giving a scheduled drug 8, then you can only write 1 number of item on the prescription. Otherwise, you can't write more than 3. Use computer generated prescription if possible. And if space is unused on the prescription, put a line across the area to prevent the addition of the items. Dentist may not order repeat prescriptions. The prescriptions and the patient. So when prescribing drugs, provide the patient with specific information about the drug, including the generic or approved name of the drug. So these dot points are important, that you need to give information about the drug to the patient also. So what you need to tell them: the generic or approved name of the drug, the expected effect of the drug, and what it is used for. Give instruction to patient on how to take or use the drug, including the dose, route, duration, and frequency of administration. For example, whether to take the medicine regularly or as needed. Potential adverse effect and what to do if they occur. Other precaution, for example, possible interaction or what is the maximum dose of that drug. You need to tell the patient when to return for review and permission to contact you if necessary. Now, patients often do not remember the verbal instructions they are given during a consultation. So it is preferable to give written instructions as well. Consumer medicine information, which is a CMI, leaflets are available for the majority of medicines prescribed in Australia, and it should be offered when a drug is prescribed or dispensed. Consumer medicine information leaflets are available from pharmacies, some clinical software packages, or online also, for example, NPS. Okay, so here is the format, example of the format required for a legal prescription, but I have heard that it has been changed and the new format is there and you can find it in new TG. So as we have discussed earlier, there should be a name of the uh, doctor, their address, their telephone number, the PBS prescribing number, okay, and then there is a patient's Medicare number, patient's name, patient's address, patient's date of birth, their age, especially if they are children, then weight should also be included. Then, if the prescription is a PBS or non PBS, if there is a PBS, then you have to take it. Then, of course, the name of the drug, full or generic name, how much in milliliter or milligram, what form it is. It is a form of a tablet, capsule, or mixture, and how frequently they have to take it. All right. Now, there was some empty space at the bottom of the page. So the doctor put a line. So no further medications can be added. Then at the end, there is a signature of a dentist, the date, and then at the bottom of this page, it says for dental treatment only. All right, so that was the format of the prescription. Um, and that ends our chapter number 2. It was very small chapter, but very informative and basic. Um, all right, so we'll see you again with chapter number 3, which is practical information on using drugs in dentistry. This chapter is quite long and very important, so we might not be able to cover it in only one episode. So we might have to, divide it in few episodes. Till then, you guys can study and all the best. Thank you. Bye bye.